Okay, I can see the numbers coming. Let's give a couple of minutes until everybody has managed to log in. Great. I can see that the numbers have stopped raising. So I think everybody who was waiting on the waiting room is finally with us. I'm just going to wait one more minute just to make sure that all the attendees are with us. Okay, so I think it's good if we start. I see the numbers keep rising, so this is great news that we have so many with us today. So good morning, good afternoon, and good evening. Welcome everyone joining this webinar on appropriate technologies to address COVID-19 related healthcare waste management. My name is Paula Padrino, and I am the coordinator of the UN Environment's COVID-19 project, and it's really my pleasure to be moderating today's event. With this session, we are putting to an end our training series on COVID-19 related waste management that started back in April this year, 2021. COVID pandemic has been with us for over a year now. Today, we are seeing how some countries are experiencing second, third waves, or even fourth waves of the virus. While COVID-19 is mainly a global health emergency, its impacts have been unprecedented on a wide spectrum of sectors. One of the most pronounced challenges that has emerged from this crisis has been waste management. We are witnessing huge amounts of discarded and potentially infectious protective equipment, or PPE, such as single-use masks, gloves, wipes, bottles of sanitizers, etc. These items have not only been found in our streets, sidewalks, roads of many population centers around the world, but also these items have been found in shorelines and seabeds as well. During our first webinar back in April this year, we looked into factors influencing COVID-19 healthcare waste management. We provided an overview of handling and collecting waste, storage and disposal options, such as thermal or chemical treatment technologies. And also we looked at the importance of regulatory framework, guiding principles, and what is the international guidance that exists nowadays. We concluded by providing a case study of Sudan. Our second webinar that took place in June focused more on COVID-19 waste and the informal recycling sector. We are aware that tens of thousands of people globally are involved in waste picking activities. The COVID-19 situation has impacted the livelihoods of waste pickers and increased the stigma of their jobs. That is why we decided to give some particular attention to this issue. Also in June, we outlined some of the safe practices that should be incorporated to reduce the potential health and risks of the people involved in this informal waste picking. We ended up by providing another case study, but in this case, the case study was Afghanistan. Today, we have a great panel of experts joining us, and for the next hour and 30 minutes, we will look more in depth into some of the technologies that can help with COVID-19 related waste management. We will start off by looking into some of the various technologies and approaches that can be considered for use around the world. We will continue by understanding that an enabling environment is crucial if we want to have a successful waste management strategy and we want our waste management to be successful. And finally, We will conclude with some of the recent developments and latest technology. So before I pass the floor to our first speaker, I would like to encourage participants to submit any of your questions at any point using the Q&A section in your dashboards. The way this session is structured is that we will first go through the presentations of our 3 invited panelists, and we have allocated some questions and some time for Q&A at the end. As a reminder, all of you who have participated in this webinar or any of the training series will receive a certificate of participation tomorrow in your emails. In addition to the certificate, in that same email, you will find a link to a Google Drive folder where we have made available all the presentations, video recordings, handouts, and other guidelines that we think could be useful for you to have and to download. All right, so without further ado, I would like to introduce our first speaker of the day, Mr. Martin Stewart, who is an international expert and chartered environmentalist with over 30 years of experience in environmental, waste management, and risk assessment for field operations and programs. Martin is currently engaged as a hazardous waste specialist with the Rapid Environment and Climate Technical Assistance Facility under UNEP to provide technical assistance to global UN peacekeeping and special political missions to improve their solid and hazardous waste management. So Martin, welcome. The floor is all yours.
Thank you. And I'd just like to say good morning, good afternoon, and good evening to everyone here. It's a pleasure to be invited to the webinar to provide you with some of our expert sort of guidance, but also some of our experience, and to try to convey that to help you to be able to select waste management technologies for COVID-19 waste, biomedical waste in general. So yeah, without further ado, let's move on. So next slide, please. So when we're looking at the selection of appropriate waste solutions or technologies, there are several considerations and criteria that we need to understand before we go through that selection process. Firstly, probably the most important thing is that COVID-19 waste should be treated and disposed in the same way as other biomedical wastes. They're not different, they're infectious, and also general biomedical wastes are infectious, etc. So they should be treated in the same way. So if there's a robust system in place, you should continue to use that system to treat these wastes. However, if you're with COVID being a global problem, and with the amount of PPE, that's the protective equipment that is used, there's often situations where overburden of waste can occur, increasing the waste problem for any facility or any community that have to deal with that waste. So when we're selecting a technology, we should be always trying to reach or trying to select technology that's the best available technology out there. Okay, and we're going to go through some of those technologies through this presentation. But these can range from, say, industrial to artisanal technologies, depending on the situation that you're in. And if you look on the right-hand side, this is a schematic produced by the World Health Organization, which basically hierarchically explains to you better technologies down to worst case uncontrolled waste combustion technologies. Now, this will depend on your particular situation, whether your facility, whether you have the resources, etc. And whether you're talking about you want to procure an interim technology, a stopgap solution, or you're in a worst case scenario where then the technologies may be limited. So things to consider when you're determining which type of and sizing, etc. of your technology is primarily the amount of waste generation. Now, what is the daily waste generation? Because that daily waste generation, you want the equipment really to deal with it in an efficient way, to dispose of it adequately, so you're not burdened with slow accumulations of that waste at that site. So are we talking about, is it a constant amount, or are you talking about you suddenly have to deal with an emergency overburden because of the cases in your particular area or facility have increased? Also, other things to consider are the placement site. Are we talking about it's an urban site? Are you in the middle of a city? This may have restrictions on certain technologies such as incineration, or is it a remote site where those aspects will not be so important? Do you have availability of an internal site where you need to consider how well that equipment will work inside a building, or external sites, etc. And also with all of these sites, you have to look at the environmental risk, but also the health and safety risks of using this equipment and how any impacts that it may cause in that regard. Now, also, we can procure and select equipment, but it's not only just gaining that equipment, it's also the daily operations of that equipment. So you really do have to consider who's going to operate this. Do you have available operators there? Will you need to get operators trained, etc.? And that will be further discussed in a later presentation. So the available capacity for operations is important. And also, ultimately, the financial resources. What are the economic resources? Do you have the funds? But not only for procuring the initial units, but also the operations itself. What does it cost to operate those particular pieces of equipment? And then, to gain equipment, if you're buying new, we normally go for a procurement process. Now, if you've done your homework and you've already identified the exact piece of equipment that you would like to select, then you could go for a direct sole source, which is easier because you already know that equipment, you've already done your homework to ascertain whether it's fit for purpose. Or normally with lots of agencies, etc., or municipal governments, there needs to be an open bidding process to show fair tendering of those contracts. So that will depend markedly on how you approach selecting that piece of equipment. Next slide, please. Next slide, please. I'm not seeing it if it's changed. Okay, I see it now. Okay, so the best available technology using the unit sustainability assessment of technologies methodology is a really very valuable tool for selecting appropriate equipment. Okay, now this is explained in there's a series of fact sheets produced by UNEP on technologies, and this is treatment options. And this tool is aligned with both the World Health Organization, but also the Basel, Stockholm, and Rotterdam Secretariat advice. Okay, now the SAT criteria is an iterative process that you go through, looking at the various conditions that you have and all of the various criteria that may influence your selection. And you can see a list of them here, such as local conditions. Obviously, you would have to align any technology with the local regulations. You're allowed to use that type of technology. But also it considers social, economic, environmental, and various risks, technical, etc., health and safety risks in that choice, in that process. Now it covers the whole chain of medical waste management, and that can be both from the strategic and also the operational level. And you can, it can apply to simple technologies, such as for source segregation, or also to more complex technologies for advanced disposal of the medical waste that you may have. So this is the footnote, the link to the site, and we would really advise, especially if you're talking about large scale, more complex equipment, you should go for this process to really see whether the technology that you want to select, this will help you in that process. Next slide, please. Takes a while for these slides to change. I'm still not seeing it.
Yes, I'm in contact with Thomas and he's having some internet issues. It's just a bit delayed. Let's see how it goes. If not, we can change presenters and another person will share the slides.
Okay, it's moved on now. I can see the slide. Okay, so just to go back to the procurement process. Well, in our experience, working with peacekeeping missions, where we have to go through an open bidding process, is that there is often some problems that I highlight in here that I wish to explain that should be considered before you go through a procurement process. Now, really what you're trying to do is to produce the best of it, to select the best available technology, and that should equate to high quality equipment. Now, to ensure that you get high quality equipment, you need to have a very precise and detailed process for that procurement. You will need to produce, first of all, a clear and detailed bill of quantities. That bill of quantities is how much waste this equipment will be expected to deal with. This needs to be clear because the manufacturer of this equipment needs to know precisely what scale of unit they should provide or they should tender for this bid. Okay, now underlying this are the technical specifications. Now, if you don't have detailed technical specifications, you can have problems with the quality of equipment that is put forward for this tender exercise. So the specifications should include the technical performance of the unit, but also the material quality that the unit is made from. So all technical components and material grades, if there's high grade metals needed for, say, shredder blades, etc., or the incinerator body, they need to be clearly explained. Also, any operating standards that the unit should perform to, and say for incinerators, again, emission standards, and whether you need to ensure that those standards are met, whether you are cautious in that you would like peripheral equipment included, such as pollution controls or automation, such as automated feeders to feed into an autoclave or into an incinerator, etc. You also need to outline your sterilization or incineration minimum temperatures and any retention times, such as in the secondary chamber, and any other critical performance criteria, such do you want a control panel with analog switches, or do you want to go for a touch screens panel? And that will depend on the location that you are, and if things break down, can you fix them easily? Analog tends to be more fixable than something which is digital. Now, also what we would stress is that you should include in any procurement exercise spare parts for a minimum of 2 years, and the consumables that that type of technology will use, such as filters in the case of an incinerator, thermocouples which measure and read out the temperature into the control panel. Those are robust, but they will last less time than the unit, so you will need to replace them in the lifespan of the unit. Also, shredder blades. These are, if they're in an autoclave or in a sterilizer, these will wear out quite quickly because they're doing a big job of shredding all that material, and you may have to have spare blades of a high quality for that. And also what we would encourage you to include is the training of operators and the commissioning of that equipment, whereby you get the engineer from that particular manufacturer to come out to the site. He trains up the operators in how to use it on a daily basis, but also they commission and often maybe cure the unit, etc., things like this. So the commissioning of the unit is good because then it will hold the warranty, etc., and you will have less problems if you have to commission the unit yourself. Now, if technical information is not detailed, basically all the bidders, whether it's low quality equipment or not, will easily pass the technical evaluation. Then it comes down to normally a second phase of the tendering exercises. Then once the technical evaluation is closed, it goes into financial evaluation, where if all of the poor quality equipment is passed, it normally equates to that it's cheaper, and then that will pass through the financial sort of evaluation. You end up with low quality equipment. So be really guarded. It's really important to get these specifications right to really ensure that you get the equipment you need. And not only are the specifications important, the actual technical evaluation of the bids that come in is critically important. And you should ideally get the people who are preparing the specifications to do the actual evaluations of those bids, because they wrote those specifications and they understand the levels of that material performance or quality. So, normally tenders come in, they send a bunch of information, but it needs to be painstakingly filtered through to make sure that all of the things that are claimed by the manufacturer of these pieces of equipment, that they're checked for correctness and conformance. Okay, so and also, you know, in our processes, we've often seen that there's a good piece of equipment, but they haven't fully agreed with the specifications, or with not with the specifications, but the amount of documentation that needs to come through with a tender bid. And in these cases, you should be rest assured that you can always go back, as long as you're not intervening into the tender process of making it unfair. You can go back to manufacturers, and if there's missing information, ask them to provide that information. And if they are serious in that tender bid, then they will provide that information accordingly. Next slide, please. So what I'm going to do now is go through the list of technologies from on a hierarchical basis, from the preferred technologies through to the lowest denominator, let's say the worst case scenario that may be available to you. I actually do not see the presentation now. Okay, it's back.
Yes, sorry, Martin, I was just taking over the presentation slide, which I think must be faster. So I think we were on this one right now.
Okay, great. Okay, well, look, let's start with the preferred technology. Now, for biomedical waste, it is recognized globally that the cleanest technology you can use is some form of autoclave or sterilization for biomedical waste. Now, this is there's advantages and disadvantages for every type of technology that I'm going to go through now. But this is the technology that is considered a cleaner technology. It normally works using a high pressure or steam temperature system, or microwave also, that basically sterilizes all of the infectious waste, so that the end point in is that waste is thereafter not infectious anymore. You can get usually autoclaves in clinics, etc., are small units, and they're used for cleaning equipment, etc., that's reusable. But also you can get large units, such as the picture in the top right hand corner, which can load in on different levels lots of bags of waste to be sterilized. In the middle, you've got in the bottom right hand corner, you've got sterilization, and these tend to have shredding as part of the process. This will enable the volume of the material to be reduced somewhat, but this is not always the case, and sometimes after the material has been sterilized or made safe, the infection taken away, it can be shredded with a normal shredder thereafter. And the disadvantages, or the advantages of this, as we said, is there's no emissions, but there could be some odors or potential volatile organic compounds that build up in the area. So you have to make sure that there's good airflow in the site that you work in, etc., and you've got some maybe an extraction system to help avoid that. The good thing is that there's no ash, as in the following slide when I discuss incineration, there's no ash to be disposed of. And if shredded, you will get partial, as I said, volume reduction. Okay, and the waste thereafter is inert, so it can go to a landfill site, etc. Now, however, while it can be landfilled, if that landfill site has a tendency for lots of open burning to be conducted, if you're putting this waste into that landfill site, it can be open burned, and this can result in port emissions, etc., polluting emissions around the site. So this is not a good thing. So it's always better to send it to a site where you know that there's not extensive open burning. What you also need to consider is that if you're sending full unmutilated PPE to a site, this could be extracted and reused. There is evidence that this is being done and the masks resold as new, and this should not be the case. So this can be addressed by shredding of the material either before or afterwards, or hand manual mutilation of those materials once it's made non-infectious. Next slide, please. So moving on to twin chamber biomedical incinerators. This is a secondary preferred technology. It's quite common globally, but it does have some downsides, which I'll explain in a moment. You can see there's 3 photographs here, 3 different sized examples of biomedical twin chamber incinerators. They need to be fit for purpose, and that means that they need to be specifically biomedical incinerators because they've been designed for that purpose. The temperatures should be between 850 to 1100 degrees, higher if possible. And there should be a 2 to 3 second retention time in the secondary chamber. You can see on the left-hand side, there's an upper chamber just below the chimney, and that is what's called the secondary chamber. And that basically burns the gases. The material you place in the bottom, that's burned. It then goes round and gets secondary. There's a secondary burner in that chamber, and it burns the gases to make the emissions that much cleaner. And what the good thing about incineration, it immediately comes down to a 95% reduced volume. However, as we said, there can be negative emissions that result from that. It depends on how you use the unit. A high quality unit should generally have minimum acceptable emissions, but that depends on how they're used. Now, you can ensure that those emissions are safer and less polluting by introducing some peripheral equipment, such as a Venturi wet scrubber, but also pollution control systems, which tend to tack on to the end of the incinerator. That may include ceramic filters or lime dowsing to neutralize any acidified gases, etc. And what's really important for operations is that the units must be cured. If you don't cure the units properly, and there's normally instructions in the instruction manual, you should get, if the manufacturer comes out or their engineer comes out to commission the unit, they should conduct the curing, because it normally takes a few days of slowly building and then reducing down the temperature. Also, when you're using the units thereafter, you should always preheat the unit to ensure that the refractory lining is fully heated up, so that immediately you put the material, the waste material in, it will start to ignite. It can often even self-combust even with the burners off if preheating is done properly, and that should be for a minimum of 30 minutes. You should ensure that you put in proper feedstocks to those incinerators. If it's wet, it won't burn well. So you need to, if it's all plastic, you're going to get more polluting emissions. So you need to balance your feedstock. So you need to segregate your waste well, make sure that your handlers have the proper PPE if they're engaging with that waste. And then, but to make sure that your feedstock, that you have balanced burnables going through your incinerator. If you've got that and you've got this system of very good feedstock, you can move on to batch loading. This means that you can be putting in bags of waste one after the other. Every 15, maximum 20 minutes, you can put another 1 or 2 bags of waste, depending on the size of the incinerator. Now, if they're poorly operated, if the operators are not well trained and they don't respect the protocols of proper operation, or if they overload the incinerator, or they don't put a balanced feedstock, they can get negative emissions, which are dioxins and furans, which are persistent organic pollutants, which are highly polluting and will slowly degrade the area with the emissions as they settle down onto the soil. Now, also what you need to consider is incinerators probably have a higher operating cost than, say, autoclaves, etc., which is using steam, water, electrical technology. This is using diesel fuel for the burners. So, and the larger the incinerator, the more diesel fuel that will be used, the higher the cost. Also, you need to consider that any ash that comes out, even though it might be reduced to just 3 to 5% of the total volume that went in, it should be considered hazardous waste because it was biomedical waste materials. And you should collect this, and you should go through a process of what we call encapsulation, which is encapsulating that material into a concrete or sand cement mixture for later disposal at landfills. Next slide, please. Now, moving on to what we would call interim solutions. These are solutions that maybe in a lower resourced environment, they may be adequate for dealing with COVID waste, but we would not want to see them really, we would never recommend them for long-term solutions. So more of a stopgap solution until maybe you can gain funding, or the funds can be provided from the annual budgets for more advanced equipment. Okay, so slide. Okay, so now looking at these are what we call de Montfort brick-built incinerators. Now, this design is a specific design, and I must emphasize this is a specific design. There are plans, and you can find these at the link at the bottom of the slide, but these have been designed over many, many years, and there's been different iterations of these incinerators, and they do work quite well. As I said, it shouldn't be a long-term solution, but a stopgap solution. But they're relatively cheap. The advantage is they're relatively cheap and quick to construct, and they do not cost that much. But however, there are some disadvantages. So the advantages is that the designs have been tested, okay? But you must put them on a concrete base, okay? And the siting is always, with any incineration, is vitally important. Prevailing winds, location to adjacent communities, etc. Now, fire bricks are better than normal bricks because they won't last as long. So if you've got proper fire bricks or stone, this can be used in place of just maybe clay bricks. But they're low cost. Generally they would cost around $1,000 to construct. Okay, you could have 1 or 2 units, and where you can be feeding one and then preparing the other. Okay, the disadvantages is that they don't have any automated burner firing system to start them. So you need to be the fire starter, and you normally do this by putting the material in, and then you use some oil or some diesel on top of that fuel to start it. Now, initially they do have poor emissions, okay, but once they've heated up, the refractory inside is heated up, and they've been used for a period of time. The emissions will improve, so they become less polluting, let's say. However, they do have a short lifespan. I wouldn't say they would last beyond 5 years, probably less, 3 years, and you would have to build another. And you should not care. It's really critical that, as part of the burn cycle, that you get airflow. So you don't want to pack them full of your waste material, because that will restrict the airflow and the burn efficiency will be lowered. Next slide, please. Now, another commercial interim solution are these air induction barrel incinerators. You will see in the picture that they are basically a barrel with a hose that's connected. This is connected, these units are connected to electricity, which starts a fan, which brings in airflow into and creates a cyclone into these barrels. Now, these are not really meant for biomedical waste, but what we've found, and we've used them, we had an emergency contract for them for peacekeeping missions, that they're ideal for treating overburden of PPE, such as masks, etc., or even medical gowns. They burn very efficiently at about a lower temperature at 650 degrees centigrade. They're easy to operate. You can move them around. They're completely portable. Okay, they're also very good for solid waste as well, and they can be procured in a short time frame due to their size, and you build them on site. It's very simple instructions. However, I do want to point out that without air induction, normal using a barrel without this air induction is not sufficient. It's basically akin to open burning. That means that the temperatures, whereas these barrels with air induction are 650 degrees, that other barrel will be about 200 degrees. And so the emissions from that will be highly polluting. So we would not recommend just using a barrel per se, with this specific technology. You can see there's links here for the different companies, and there is also an instructable where it does show you how to construct one of these units using a blower system that will create the cyclone. So you can see those designs at those particular links. Next slide, please. Now, moving on to really the least preferred method of disposal of COVID waste, and that is on-site pit burial. We would not like to see this done, and this should only be done in an emergency situation where you're overburdened with COVID waste and you have no alternative, there's no resources available, but you at least want to make some effort to ensure that cross-infection of those wastes does not occur. So we would say that these pits should be dug, but ideally covered. You see here, this is a a metal frame with legs that stick down into the earth, and then there's doors that are put on top, and the hole is obviously dug underneath, and then the wastes are thrown in and the doors are shut. The doors will discourage vermin. You don't want vermin going in there and dragging this material out, and even dogs and maybe other animals, wild animals, could be encouraged, and rats for sure, could be encouraged to go into those sites and drag some material out. So if you are going to do this, we would say that you need to use clear signage to warn that it's a dangerous location, that it's got infectious materials in it. We would say that you should also try to line it to make it a bit more impermeable, putting either a render or clay on the inside or plastic liner or something to prevent sort of leaching of this material. You should certainly put it away from any natural environmental sensitive areas such as waterways and water sources, and certainly away from crops. You don't want any uptake of infectious material into those crops. Now, a typical pit will do about 5 to 10 tons, so you may need multiple pits over time. So any planning for that you should do, and you should also put a daily soil cover over the waste as you go along, and maybe also disinfecting it occasionally with a low dilute solution of sodium hypochlorite. While in the first slide that I showed you, there was on the WHO, they do say that some open burning, pit burning could be done. We at UNET feel that this produces too much pollutant emissions, and we would not recommend open burning in any circumstance. The schematic has been copied from the WHO document, which you can see the link here. Next slide, please. Yep. I think this is my final slide.
Yes, so if you can wrap up, Martin, that would be great. Thank you.
Yeah, okay, just to sort of say that, you know, if you're going to dump COVID waste at a landfill, we would not recommend this at all. But if there is no alternative, we would certainly not do it in a situation such as the right-hand photograph. We would recommend that you have a specifically excavated trench that you put the material in, and you should have soil cover every day. You should demarcate it and not allow anybody to go to that site by having some hazardous warning signs, etc. But you should not definitely just take these COVID waste to open dump sites and dump them, especially if there's lots of waste pickers, as we mentioned before, and also if there's open burning at those sites, because the potential for highly polluting emissions, but also cross-infection, can have harmful consequences on both pickers and the environment. So that's the slide. I hope that information has informed you a bit more of the current technologies. And I thank you. Over.
Thank you very much, Martin. It was a great overview of the different technologies, and I already see a few of the questions coming in from our audience. So now I'd like to move on to our second speaker of the day, Mr. Mike Cowing, Chief Technical Advisor of the Resilience to Disasters and Conflicts Global Support Branch. Mike is an internationally renowned waste management expert with more than 35 years of international experience in over 60 countries around the world. He has provided waste management advice after disasters and conflicts in multiple locations, and he is currently leading activities in the HYPER project in Ogoniland, and he was part of the team which produced the 2011 environmental assessment of Ogoniland. Finally, Mike is a chartered environmental scientist and waste manager as well. So without further ado, Mike, I invite you to take the floor. Over to you.
Okay, thank you very much indeed, Paula, for the introduction. Thank you, Martin, for that overview of available technology for the management of COVID waste. So what I would like to do is talk about what we're referring to as the enabling environment. And this really talks to those factors which support the identification and the procurement of the desired technology, whether it's autoclave or incineration, or as we hear later in Anna's presentation, other technologies. So I'll take the next slide, thank you. Okay, so what do I mean when I talk about the enabling environment? Well, really, the enabling environment considers a lot of parameters which often, sadly, in our rush to procure technology, often get overlooked, or not all the factors are given due consideration. And when I talk about the enabling environment, there's a number of factors such as institutions. For interventions to be successful, we need strong, robust institutions. And those institutions need clear roles and responsibilities. And the staff therein need to be well trained and competent to do their particular roles. Now, in terms of institutions, we could be talking at the higher level, which could, for example, be the ministry, typically the Ministry of Health or the Ministry of Environment. And they need to really set the agenda. They need to provide the strategy, to provide the policy and the standards to which we have to operate to when we're handling COVID-related waste. So again, we need strong institutions. Also, we need legislation in place, a legislative framework, which means the legislation often set at federal or national level, but we also need the guidelines in terms of local operations of what operations are going to be done to achieve the legislative standards which are set. The flip side of legislation is that we also need enforcement. Now, very often in many of the countries I work in, it's not the absence of legislation that is the problem. Very often legislation does exist, but it's the absence of enforcement which is the problem, which means that really the legislation is little more than ink on the page because it doesn't transmit down to the operational level, whereby entities, whether it's a ministry or whether it's an agency with the responsibility, actually follows up and actually enforces the standards and enforces the guidelines. So in the case of waste management, generally, specifically with COVID waste, is there an entity that is making sure that the standards are being applied and the guidelines are actually being achieved? That means if we're dealing with contractors, for example, contractors operating incinerators or operating autoclaves, are they operating those in compliance with the environmental legislation as it pertains to, example, for environmental discharge through the flue stack, for example, in the case of an incinerator? If we're dealing with third parties or contractors transporting biohazardous waste and COVID waste, are they complying with their contract specifications? Are measures being taken to ensure that the waste actually reaches the final licensed disposal site? Sadly, there's many incidents. It's not uncommon for a lot of waste to be illegally dumped by these contractors before they even reach the designated disposal site. So we need enforcement. We also need education. That means staff within the institutions, whether it's healthcare centers or clinics, they need to be educated. They need to be educated in terms of what are the correct procedures, how should the materials be handled. And if we turn to the general public, we also need an educated general public in terms of for them to comply, for them to understand the guidelines. If biohazardous or COVID waste is being generated within the domestic environment through people being treated at home or people isolating, then they need to comply with what their requirements are in terms of the proper bagging, packaging of the waste. So education both within the institutions and education of the general public as well. Then we come to finance. Finance really is, if there is one key thing, it's going to be finance. I've done a lot of work for UNEP and other international agencies looking at waste management interventions, looking at COVID interventions, and trying to learn lessons about why they don't work or often don't work. And if there's one factor which crops up more often than the other, it's the fact that finances haven't been put in place. And that means very often, whether it's a donor or development agency, make the funds available to buy the unit, again, could be incineration, could be an autoclave, but the recipient entities, whether it's a large central hospital or whether it's a treatment center, simply don't have the budgets in place, don't have the cost recovery in place to operate and maintain and repair and purchase the spare parts that are necessary. So we were hearing from Martin, when you procure, there is a need to make sure that you're procuring with, say, 2 years spare parts. Often it hasn't been done, it needs to be done. And we can have situations where relatively new technology is procured and commissioned, and within a very short period of time, perhaps sometimes less than 1 year, they become unoperational because there aren't the financial resources available to maintain and buy the spare parts. And then finally, technology within our enabling environment, and we heard from Martin some of the selection criteria, but the ultimate technology procured needs to be appropriate. And by appropriate, I mean, is it appropriate to the national and the local setting? Is there the skill set to operate the technology selected? Or if not, are the staff trained in how to operate the new technology? So the technology needs to be appropriate, both in terms of it's financially appropriate and it's sustainable, that it can be operated in the long term and not break down and become redundant in a short period of time. Next slide, thank you. So if we look at the enabling environment, if we consider these institutional, environmental, financial, educational requirements, then we can start to set about making sure that our interventions in treating COVID waste are strategic, that they're not short term, and that they will actually in the long term be sustainable. And again, it's not just about looking at the technology, which often tends to be the case. If a donor or development agency is working with a government, then we're working in an environment whereby we need a quick solution. Ticks need to be put in the respective boxes quickly. And in a pandemic, there is obviously the need to act quickly. But again, if we're not doing it strategically, if we're not addressing the enabling environment, sadly, these interventions are not going to be workable for the intended timeline. Again, we need not just to look at that technology, but we need to look at those factors which contribute towards this enabling environment. And later in a few minutes in my presentation, we'll look at some specific case studies where I will suggest perhaps greater attention should have been paid to that enabling environment. Next slide, thank you. Now, when we talk about the management of COVID waste specifically, or if we're talking about management of hazardous healthcare waste more generally, then we need to adopt this cradle to grave approach, or the whole chain of utility as it is. And this means that we're not just looking at the end point, we're not just looking at disposal, but we've got to be looking at the whole chain of activities, which means the starting point is to minimize the amount of waste which is being generated. Then once the waste is generated, we have to have proper segregation, proper packaging, proper color coding to raise awareness so that all of those within the chain of utility are made aware of the hazards and the risks. Then we have storage either on site within the healthcare center or storage off site if we're moving the waste to an off-site centralized treatment facility. We've got to look at the transportation, again, both on and off site. And then the final part of the consideration is looking at treatment and final disposal. So again, that really is in concert with the need for a strategic approach and for looking at the whole chain of utility, cradle to grave. Next slide, thank you. So some of those sustainability factors, I've called them, some of those factors which contribute to this enabling environment is strong institutions. Now, the institution that we can talk about, there can be more than one institution involved in this phenomenon. We could be talking about the Ministry of Health, and again, needs to be strong, needs to be communicating clearly to the waste generators. What are the standards? What are the procedures? What are the targets to be complied with? So we also have institutions within the healthcare sector itself, I see Paula's testing me here with the slides, but that's okay. I can continue. I think I remember what was on the previous slide. So we're talking about also institutions within the healthcare centre themselves. Healthcare centres themselves change or can be very variable in terms of their size. We could be talking about large centralised hospitals with thousands of patients. They themselves would typically treat the waste on site, or we can be talking about small, remote, rural clinics. So different in scale, but still the requirements are the same. And we need someone within the management of the healthcare centre to be given responsibility, ultimate responsibility for managing the COVID waste. So as it were, the buck stops here, a senior individual within the management of the facility. Then we also, if we're talking about a large setup, we need to typically have a hazardous waste management committee who can monitor activities, who those involved in actually executing the task can report back to the committee, and the committee can look at the problems, set standards and make recommendations to be followed within the operational arena. We need a chain of custody in terms of within the healthcare sector, who is responsible for doing what. And we also need clear lines of communication. Very often where we find problems in the management of COVID waste, in hazardous healthcare waste, it's been people are not correctly trained, people don't understand the risks, don't understand, as it were, that chain of utility, who's meant to be doing what and when. All of this needs to be clearly articulated, reported, and trained if we're talking about the required strong institutions. Next slide, thank you. There are some recommendations if we're talking about large healthcare centres such as hospitals, is that when new staff, whether it's operational or janitorial or medical staff are taken on, that there should perhaps be a clause in their contract articulating their role with the management of COVID or hazardous waste, and in so doing, communicating the importance of getting this right, that it's flagged up how important the correct procedures, techniques, equipment are. Again, we need regional and national support, which would come from the ministries in terms of providing technical backstopping and harmonizing the procedures, harmonized between the different waste generators. And central government should be providing, as we've mentioned before, the strategic apparatus within which the different generators are operating. Next slide, thank you. These are some of the things that typically strong institutions would have to be catering with, putting in the correct procedures, putting in and training the staff. At the point of generation, then we move to segregation at source. This can only happen within the institution if we've got the correct equipment, if we've got the correct color coding, the correct packaging. Collection and transportation, again, we need the correct equipment, we need sealed containers, we need trolleys which are washable, can be disinfected. On-site storage, there's particular requirements for the safe storage of the COVID waste so that the risks are not being transferred into the broader environment. Again, this has to be captured and dealt with at the level of the institution. Whether we're dealing with on-site treatment, we need adequate facilities to be in place. And indeed, if the waste is being transported off-site, we need to have the correct equipment, storage, transportation, vehicles in place. Very often this will be contracted out. We need good contracts in place, appropriate procurement procedures, as we were hearing from Martin. And again, when we get to the final treatment facility, very often these centralized treatment facilities will be run by private sector contractors. So the whole need of proper contract specification and procurement in place, again, as we were hearing from Martin. Next slide, thank you. We need training within those institutions. We've heard that the staff need to be adequately trained. Training is an event, or rather is not a single event. Training is a process. So it's not a question of ticking the box that yes, all the staff have been trained. Training requirements have to be monitored, have to be dynamic, and training has to be taken on an ongoing, frequent basis. The sort of things that we should be training the medical staff and the janitorial staff is issues relating to personal hygiene, the importance of immunization, personal protection in terms of what is the correct personal protective equipment. They need to be trained in identifying the risks, the proper packaging, segregation, labeling, transportation of the wastes. And they also need to be trained in what happens in the event of an accident, whether it's, for example, a needle stick puncture type injury to staff, or what do we do in the incident of spillage when the contaminated waste is spilled at some point of that chain of utility. Next slide, thank you. The need for data, again, we heard it in the case of Martin, but very often I find that when international development or donor agencies are interfacing with governments, interfacing with the health ministries, very often there is a lack of data, and we need good data. And this is something that doesn't need to await the intervention of the international community. We can be generating good data within the ministries themselves, within the healthcare centers themselves. We need to know how much waste is generated, what type of waste is generated, what fraction of that is actually hazardous in nature. We also need data in terms of where the waste is being generated, where are the hotspots, the center of generation. We need to know what available technology pertains presently so that we can estimate, okay, what's the additional capacity required by this so-called surge, which is being generated in the event of managing the pandemic. It's not the first pandemic, it certainly won't be the last pandemic. Lessons have to be learned so that we're better prepared both to manage this pandemic, but any future pandemic. Next slide, thank you. As Martin's mentioned, UNEP have produced a number of fact sheets which are available for your use. These fact sheets have a lot of good information and instructions and procedures and will help yourselves or your entities or your organizations go about things in a more strategic fashion. More strategic should infer in the long term sustainable. There's issues on national waste capacity assessment, inventorization of wastes, treatment options, etc., etc. So again, the whole chain of utility or cradle to grave is covered, is addressed in these fact sheets. Next slide, thank you. When we're selecting the appropriate technology, then we need to know what the options are. We need to be, again, going back to Martin, when we're selecting technology, there are tools there to help you. There is UNEP's sustainable assessment technology. There's guidance on best available technology and best environmental practices. When we're evaluating technology, we need to be evaluating not just the cost, but we need to be evaluating what are the social aspects in terms of employment or impacts on the environment, impacts on the community. We need to be looking at what the issues are regarding health and safety. So we need to build up a matrix of factors to be evaluated when we determine what is the most appropriate technology. Generally, as we were hearing, the preferred longer term solutions are heat treatment, whether it's thermal steam sterilization or whether it's combustion through incinerators. But there are other short-term stopgap measures which can be employed while we're developing the longer term strategic response. Next slide, thank you.
Yes, Martin, we're a bit tight with time, so if you can go quickly through the next slides as well.
Absolutely, thank you. So we'll move on to the next slide. In the interest of speed, we can skip some of these slides. We can slip that one. Okay, let's quickly look at some case studies. I've worked in the last 12 to 18 months with a number of countries specifically responding to COVID waste, and I've looked at some case studies. Country 1 is Central Asia, country 2 is Asia, country 3 Eastern Caribbean, and country 4 South America. So let's have a look at this enabling environment and where we've ended up. Next slide. So talking about the country in Central Asia, it lacked the enabling environment. We had weak, fragmented institutions. We had low levels of training. There was little if any data available. Available technology was a patchwork of old, dilapidated incinerators. Importantly, finances were not put in place and enforcement was weak. So the outcome of this intervention is that no international donor or development agency has yet been engaged. No funds have been provided for the procurement of solution. And this really relates to the absence of the enabling environment, and these factors haven't been addressed, which means sustainable intervention can't yet occur in this Central Asian country. Next slide, country 2. Country 2 is in Asia, a different scenario. We had stronger institutions. Training, again, needed more attention. We had good data, which was important. Technology selected was a combination of incinerators and autoclaves. Finances were adequate, funding, but not adequate necessarily for the long-term operation and maintenance. And legislation was in place. So we had most of the key factors that we needed. However, what we did have, we had donor funds mobilized, we had investment in incinerators and autoclaves, but we had problems with the autoclaves. Many of the autoclaves broke down. The part of the autoclaves that were problematic was the chippers and the macerators. And this is because, as is suggested in the photo there, whole coconut husks or partial coconut husks were going into the autoclave and were breaking the chipping mechanism. Now, this tells of two things. It means that the operators haven't been well trained and that waste segregation isn't happening to the correct extent. So the key problem here in the enabling environment was an absence of appropriate training. Next slide for country 3. Country 3 is in the Eastern Caribbean. Good enabling environment, good institutions, good data, appropriate technology selected. But again, we had problems in terms of funding, that the money was there by the donors to procure the autoclave, the centralized autoclave, but the autoclave broke down. And the agency operating, the government agency operating, did not have the money to procure the new equipment to replace it and maintain it. So that was within 12 months. This autoclave broke down, couldn't be repaired. What then happened was the waste was being dumped in excavated pits within the landfill site and backfilled and buried. So we've pretty much gone back to square one. And why have we gone back to square one? Financial considerations were not given due attention. Final slide, which is country 4, which is in South America, where I was helping the government entity in South America. Again, we had good institutional setups. We didn't have sufficient training. We had good data. Technology selected was autoclave to be operated by the private sector. But again, inadequate funding. So in the short term, the biohazardous and COVID waste was going to the landfill where it was being burnt. This is an example of why we don't burn on the landfills. The landfill site caught fire. The fire burnt for several months. The the South American country had a large touristic infrastructure which was severely impacted by the noxious fumes. So it had a longer term economic knock-on as well. Our final slide is the summary slide, in which really I just come back to the point of we cannot just focus on the technology. We need to look cradle to grave. We need to look at the enabling environment. We need strong institutions, data, cost recovery, training, enforcement, etc., etc. So I've rushed through those final slides, but I hope that you have got the point. And I'll hand us back now to Paula. Paula, thank you very much.
Thank you very much, Mike. Apologies for that. This was a very interesting presentation, but yes, in the interest of time, let's move on. Last but not least, I would like to welcome to this session Ms. Ana Fonseca. Ana is a waste management specialist that has been involved in response in several disasters in countries like Indonesia, Philippines, Ecuador, Mozambique, just to mention a few. Anna has been working with local and national governments on projects to support local communities and economic recovery through disaster waste management. Currently, Anna is living in New Zealand, and she recently joined the environmental team on one of the biggest projects in New Zealand, building a central interceptor. In other words, it's like a wastewater tunnel of almost 15 kilometers long. So Anna, welcome to you, and it is really a pleasure to have you with us. The floor is all yours.
Greetings, everyone. As we say here in New Zealand, kia ora. So this last presentation on this webinar is related with the different and recent developments in terms of treatment technologies. And if we go through them, it's going to be basically what type of treatments we have, and being more specific in terms of the microwave treatments and different innovative processes that are currently being used in a few countries. What is the actually reality, and what challenges we have currently on waste management? So if we go in terms of the types of treatment technologies, we do have a few, as Martin and Mike explained before. So if we go and talk about thermal treatments, or chemical, or irradiative, or biological, what we need to focus here, it's about the thermal technology, and that will bring us on the next slide about what type of on the thermal one, you have low heat treatment technologies. That's the one that we are being focused on this presentation. And you also have high treatment thermal processes that that Martin touched briefly in terms of all the processes. So if we go into if we go into the microwave treatment, we see that the next slide brings us that the infectious waste can be treated as more specifically with the microwave, or with the microwave process, or the autoclave, or more specifically, those will be the best ones according to the WHO regulations and guidelines. So if we focus on those, I will be more into the microwave one, and that the microwave, it's basically the disinfection through the moist heat and the steam that is generated by a microwave energy. And that consists in an area or a chamber that will be confined, and the microwave energy will be generated and will create such a power that will disinfect the material that we are talking about. So in this precise example will be the medical waste or the COVID waste. And the thing with the microwave treatment is that if there is no shredding incorporated, the volume that will be achieved, it's very minimal. So that means that we are looking to have a microwave treatment with some internal shredding to allow us to have a volume reduction between 60 and 80%. And if the treatment has additional drying cycle, that we will have a reduction on the mass of 15 to 20%. So if we go on to the next couple of slides, you will see that you can have the microwave treatment. If you can pass that one, I cover that one as well, because we are kind of short on time. So if we go, in terms of the microwave treatment, you have two different types. You have the small units, so the batch treatment, or you have the continuous one that is for large scale units. So if we cover the small units, that means that you have a range of capacity smaller than the other one. So it can go until 210 kilos, and the other one could go until, so the continuous one can go and cover until 250 kilos. And the type of waste that can be treated, it's more or less the same. So we are talking about medical waste. As it was mentioned before in the previous presentation, there is no distinction in terms of COVID waste or medical waste. So everything basically is the same, and it should be treated as equal. And so just if we go and jump 2 slides to have a comparison on types of treatment, will be easier to explain and to have an overview on both continuous and batch. So the next one, yep. So in terms of technology, if we think, so what are the environmental concerns that we have, or occupational safety concerns, as well as if there is any type of job creation. So if we compare both of them, because the continuous microwave technology is a larger system, it means that it creates a bigger opportunity in terms of jobs, but all the rest stays the same. So it's a minimal environmental concerns or small potential a small potential for job creation on the small units, as you can imagine, because smalls are more compact, so it doesn't require a lot, not even in terms of maintenance. That brings us that, as Mike was just saying, in terms of the institutional requirements and regulatory requirements, things need to be very coordinated, because for the small units, although you just need a few basic requirements, but for the biggest one, for the continuous microwave technology, so the bigger units, you have some requirements, and that might include also some maintenance, so some education that is required to prepare and proceed with maintenance, as well as some costs that will going to be considered on the next slide. So that will compare how much does it cost in terms of process. So if we look into the small units, you will see that there are different costs, because it will depend on the size of your unit and how much you are actually putting in terms of waste inside. So the costs will vary with that. But in terms of the continuous system, so the larger units, the price is more or less the same. And overall, we can say, in terms of pros and cons on the next slide, you can see that it's more costly, this type of treatment, although it's one of the preferable ones that we are encouraging during COVID, or during, to be more precise, in terms of healthcare management waste. Well, healthcare management for this, in terms of treatments. So if we go and think more broadly of presenting the innovative process over the next slides, what I found is that most of the units, and you will have a few videos and information on the slides, most of them, they are compact units, so no pre-treatment are required, and they have capacity, bigger capacity for daily to treat a certain amount of waste. So in this case, for this micro auto gasification system, you can process until up to 1 ton per day, and that at the same time this system will be able to generate energy. And this is quite good, and it ticks all the boxes in terms of sustainability and in terms of environment. But if you go to other systems, it's more or less the same. So just it's the same goal. So on the next slide, you will see that although it's a different technology, or it's a different unit, the principle is exactly the same. So it's to destruct and disinfect the medical waste. And they're also compact units, no pre-treatment is required. And even the last one system that I found in terms of the sterile wave system, it's more or less the same. So it's a compact unit, no prior segregation, and it can transform all types of healthcare waste into sterilized or inert. What we find out is that as a reality, so this is what we want to achieve, correct? But in terms of reality, if we look into several studies that have been made over the last couple of years after COVID, more specifically, you will see that just a few countries have microwave treatment. So I look into a study that was done for 12 countries. So it included Africa, Middle East, Asia, and Pacific. And you can see that from 12 countries, just 2 had microwave treatments, and those were Kenya and South Africa. So what's happening and was mentioned on previous on our previous sessions today is that although the WHO guideline recommends a certain type of treatments, we are not there yet. So it means that, as Mike was just saying, there are several developing countries that are lacking technology, that are lacking education, and even they don't have any kind of treatment. So I've been in several countries where you don't have a proper place to dump the medical waste, and dump is actually the term because they don't have a landfill, they don't have anything, they just have open burns, and that's what they usually do with in terms of management, and that's not a good practice. So if we add on that, on top of that situation, if you add that in this moment we are producing between 3 and 5 times more medical waste than we were before COVID, before this pandemic, then you can imagine how the countries are actually struggling. So, and if we think that if we go to a next slide and to understand the global picture on what's going on in terms of numbers, because I think everyone is familiar on the numbers of COVID numbers, you will see that. So you have COVID is spread all over, right? And you can imagine that developing countries don't have those technologies, although they don't represent the highest numbers in terms of COVID, but they do represent the highest in terms of lacking technology, lacking education, lacking finance and human resources. And that is what we should be focusing in terms of treatment and donors, as Mike was just saying, that the examples that he just gave in terms of the 4 countries or the 4 areas, the donors, they haven't been there yet. It's not about just the management, it's about, in this moment, it's the world is struggling. So we need to focus on how can we improve. Maybe we will not achieve the best, but we need to improve step by step what we are doing in this moment. So the challenges for the treatments currently in terms of COVID or in terms of healthcare waste, I would say that it's misinformation, because a lot of things is a lot of information is happening. And in the beginning, when the COVID pandemic started, people thought that the healthcare waste management would be different for COVID waste and the rest of the waste, but actually is the same. So this leads to different types of misinformation. Also, the tricky part is that we are having more and more variants in terms of COVID, and so the treatments did need to be adjusted frequently. As was mentioned before, there is a limited of resources, human and economic resources, because the treatments are quite expensive. And education is also a requirement for this type of management, and we do need a rapid response. And I think that's it. I was able to compress everything in 10 minutes. Thank you very much.
Thank you very much, Anna. I'm turning on my camera. This was a great presentation, and apologies that we are struggling a bit with time. But I'd like to thank the speakers for these high quality presentations. And now we can move on to our Q&A segment. We will try to answer as many questions as possible in the next 15 to 20 minutes. As a reminder, speakers to turn on their cameras while responding, and I encourage the audience to continue asking questions. So we can start off. We have a few questions. That the first one perhaps I can address to Martin. So Martin, one of our audience members is asking us whether there are any portable or mobile versions of incinerators and autoclave systems.
Okay. Well, there are, but they won't be robust. More, if we go to the incineration systems, firstly, it will be more like the barrel incinerators with air induction. You know, for a proper refractory lining to be inside an incinerator, it needs to be of high grade, either concrete or fire brick material. So that will give it such a weight that it would just deny its portability. However, saying that, what you can do is you can order these units up to maybe 200 kilograms per hour onto trailers. So they can very much be portable, because you order the unit and it comes either in a container or a skid, or you can have them on trailers. And the same is for autoclaves as well. The only difference with the autoclave is that you have to connect it to the water system. But I'm sure that there's portable autoclave systems that can move around from site to site. So yes, where the need is, you can normally find a unit, and the way that it's provided to you, that will make it portable. Over.
Thank
Paula,
you.
could I maybe just contribute to that as well and endorse what Martin has said?
Yes.
Indeed, yeah, a lot of times we've used such facilities transported within ISO containers and almost done it on a batch cycle, whereby they can be moved from port to port or location to location, very often on the back of heavy goods vehicles. And that has a certain attraction in as much as you're taking the treatment to the waste, which sometimes can be more cost effective than transporting large volumes of waste to the actual treatment center. So yeah, just to endorse what Marty said, there are portable options, and in some instances where you've got more than one hotspot, it can be attractive and cost effective as well.
You know, very fair point. Sometimes it might be cost effective to move that. Now, Mike, now that you are on the line, I might address the next question to you, and I'll actually merge two of the points that two of our audience members are asking. One is we have Mohammed Ismail, who is asking a question in regards to frontline workers, and he has concern over how can employers, so companies who employ this type of personnel, how can they improve or make sure that their livelihoods are protected? So what kind of precautions can an employer take in regards to frontline workers? And I'll merge that with, why do you think there hasn't been sufficient attention given to these enabling environments? So in this case, we're talking about employers, but also sometimes institutions have not been robust enough, or these mechanisms have not been in place. So why do you think that hasn't been paid much attention?
Okay, yeah, thanks for that. Two related points. In terms of protecting the well-being of employees, then as was mentioned in the question itself, that very much is the employer's responsibility. The employer, whether it's the Ministry of Health or whether it's a health care centre, in the first instance has responsibility for providing appropriate personal protective equipment. We could be talking gloves, boots, overalls, etc., etc. Can go over and beyond that in terms of if we're working in a hazardous environment, a program of inoculations, etc., etc. So there's a range of things the employers can do. The employees themselves also are in the front line of being responsible for their own well-being, which means that working in a responsible fashion, not doing things which compromise their health, their safety themselves, bringing to the attention of the employer if there are any particular shortfalls in terms of equipment provided, or if they're being asked to work under what they consider to be unacceptably risky environments or risky tasks. So absolutely, it's the employer's responsibility in the first instance. Then the employee themselves have responsibility to safeguard themselves and bring to attention any issues of concern. The next line of defense very much so is also the employer's responsibility to give adequate training to the employees who are involved in these risky, hazardous undertakings. So it's really a meeting of responsibility between both the individual and the institution itself. Regarding this enabling environment that I've talked about, You know, we're dealing with a pandemic now. It means that there is a rush for action, a rush to respond. Things are being done very quickly. So very often the donor institutions, the development institutions are not mindful perhaps of the broader environment, and it's about providing the hardware, providing the equipment. And I think generally there's an increasing awareness that this is folly. It's not going to give the results that we're looking for in the long term. And I'm working with a number of development and donor agencies that are starting to put, let's call them, these sustainability factors within their matrix of evaluation. So it hasn't typically been addressed, quite often because we're working in emergency situations where we need quick reactions, quick response times. But I think there is a growing awareness that to be sustainable, which is the optimum goal, then we need to be looking at these sustainability factors. And I am seeing some movement within the agencies themselves to actually take these on board. So it's changing slowly, but there's certainly greater activity, greater attention, which should and can be focused on these sustainability factors.
Thank you, Mike. The next question I have is perhaps a bit more technical, and it's directed towards Anna. And they're wondering, in regards to the microwave technology that you mentioned in your slides, they're asking if there's no shredding involved, what is the effectiveness of this technology in terms of the disinfection and sterilization? So perhaps if you can provide some comments on this, or Mike or Martin, if you want to add as well.
So if I can start on that and then pass the floor. So if there is no shredding, it's not about not being effective in terms of disinfection. It's about reducing the volumes. So if you don't shred, you will have exactly the same volume that you have prior treatment, but it's disinfected.
I don't know if Martin has a comment, but from my side, if we talk about autoclaving, for example, I am an advocate of autoclave. I like the technology. The old style autoclaves didn't necessarily have chipping and maceration of the waste. And as Anna has mentioned, you don't get the volume reduction. But from my point of view, technically, maceration and chipping is a pre-requirement now, because you are going to get much better thermal penetration into the waste when we've reduced the waste size, when we've ripped open the boxes and the bags through the chipping. I absolutely would recommend this form of pre-treatment, and I would caution against, for example, buying an autoclave without this being inbuilt, because you're not going to get the sorts of results that would be desirable.
And I think that's the same for the microwave, because if you don't have shredding, you don't have those good results as you would.
Yeah, and also just to add, it also helps with any sort of with this material going later to landfills, etc. It's also mutilating the material so that it cannot be reused, which is ideally a thing to consider.
Yeah, and another consideration, Paula, for the audience. There are examples around the world where healthcare waste and COVID waste is autoclaved but not macerated. It then goes to the disposal site, and it's still absolutely recognizable as a hospital-based hazardous waste. So although technically it's been sterilized, it still causes great concern at the disposal site where people are seeing medical equipment and whatever. So it raises a lot of attention, and I'm dealing with one municipality that is refusing to take autoclave waste, even though it's sterilized, because of the concerns it brings to other users of the site. So again, I think it reinforces the importance of chipping, macerating the waste, mutilating the waste is a very essential step in today's world.
Indeed, Mike, this leads me to my next question. There was some concerns on is there an effective way to deal with waste that has not been disposed properly? So let's say for the past year, there might have been waste that has been dealt poorly around the world. So how can some countries deal with that waste that is not appropriately disposed, or they haven't finalized the whole process? Any advice on that? How can they manage that type of waste?
Yeah, happy to respond. Perhaps I'll let Martin and Anna go first, because I don't want to be accused of monopolizing the microphone.
Well, I would say it depends on what you're talking about. Has it been dumped at a site and it wasn't dealt with beforehand? I would say it's somewhat too late, especially if people have been, going over that material anyway. If there was any damage, infectious material will become less infectious over time just through the, solar energy, etc., wind, rain, etc. But if you're talking about that accumulated amount of material that has not been disposed of and it's just accumulated in a particular area, I would say that some form of technology then needs to be brought in to deal with it. And any of the technologies that we've mentioned can do it. Going back to the shredding of it as well is what often we found with some sites when they're shredding the material, it also enables it to be dumped better rather than just in a big pile. They can spread it over the dump site, and because it's macerated into very small pieces, this makes it much less attractive for waste pickers to intervene with. So yeah, so any accumulation of waste, I would say, needs to if you can get support for some type of technology to be brought in to deal with it. And I think if you've got multiple cases of that, this portability is really useful for that, from bringing in a containerized incinerator, for example, to be used to get rid of that particular location and then move on to the next location. Over.
If I can add just an example of a few years back when I was in the Philippines after a typhoon, so in 2014, after Typhoon Yolanda, what we found at the time is that there was no waste management itself in terms of healthcare waste. And so the healthcare waste was dumped on the landfill as normal waste. So everything was mixed up. And as you were mentioning, there's an attractive factor of that for the waste pickers to go there and to collect waste, because they see value on it, although it's a health risk. So what we did at the time was to create on the landfill, we created a dedicated area for them to dump the waste, and creating rules and procedures for every truck that would come for with medical waste. That truck will dump just on that specific area, and it will be immediate cover. Immediately it will be covered. So we had trucks on spot to do that, and it was fenced and it had a sign. So sometimes you need to adjust your procedures according to your context. Over.
Yeah, I know it's a small world, because I was actually in the Philippines dealing with waste at the same time as you, and I didn't realize that. Yeah, to respond to the question, it would be my experience that inappropriately treated COVID or biohazardous waste is typically in the developing world going to be dumped at the dump site. So if we're talking about that scenario, like Martin mentioned, there's different scenarios would require different solutions. But typically it's going to have been dumped and accumulated at the dump site, even though the virus of concern could have died out over a period of time. The hospital waste still poses risks for needle stick injuries, which are very common, for example, from needles and syringes. So again, in that scenario, in line with what Anna was saying, the best thing the municipality or the entity could do is, if they've got plant and equipment, most would have a small caterpillar or bulldozer, is set aside a dedicated portion of the site, create a cell as best as possible mechanically, not manually, remove the areas of concern of waste and deep bury them. And as it were, designate the area, as Anna was saying, mark it, label it, and treat that area solely as the only place where this recovered hazardous waste or incoming hazardous waste would be handled. So again, it's not ideal, it's not optimal, but it's better than nothing. Have a dedicated cell within a dedicated area of the site, duly managed and signposted, and then in so doing, burying it and keeping it from further spreading is certainly better than nothing. It's not optimal, but it is something better than nothing for sure.
Thank you very much. I think it was a great answer, and I hope all of our audience are happy as well. I am aware that we are already 5 minutes over time, but we are having such a high number of questions, so perhaps we can take the final couple and then we can close off the session. So we have a question from Gonzalo Aguilar, and he is asking some advice when it comes to the segregation of waste. So in hospitals, the waste has increased, like tripled or quadrupled, and he wanted to know, since there's many ways that it's handled and some is risky and some is not, if you can provide some advice on that segregation side.
Well, segregations is very important for your waste management system, because it may even allow some of those non-infected materials, plastic containers, etc., to even go forward for recycling, etc. So it's better environmentally. It reduces your overall waste volume. Segregation of infectious material normally would be on 2 levels, where you've got PPE and then obviously direct tissue infected materials that are used directly for the treatment of a patient. So those can be separated on those levels, but they're often not. So most infected materials are put together. Another segregation, which is sort of standard in biomedical waste management, is the separation of the sharps, which includes needles and scalpels, as Mike was referring to. So that tends to be separate because there's special boxes for those. They stack them and put them in special boxes. So those 3 elements are the sort of the non-infected containment, which comes about for medicines, etc., that can be separated, and that can go through a separate, either a sterilization process and then go through recycling, or some sort of washing system where that can then go for recycling. Infected materials has to be sterilized or incinerated, and the sharps, again, metal doesn't incinerate, so while they may go through an incineration process to make them inert in the sense of non-infectious, they would then still need to be dumped somewhere, and they still represent some element of hazard for that. But that's also the same for an autoclave system. So over to my colleagues.
If I can add just something on what you just said, Martin, is that what I found also useful in some countries and in some type of healthcare waste facilities is that you have color codes. So color codes associated with the different types of medical waste, and that helps people to actually visualize and identify, okay, this is infectious, or this is biological, or this is non-infectious, and they have different color associated to those categories.
Yeah, agreed. And just to endorse, waste segregation really is the front line of proper waste management. It's the starting point. And to achieve it, we come back to this, or I come back to this point of needing strong institutions. Strong institutions, whether it's the ministry taking the lead or whether it's the healthcare facility, making sure that the staff are fully trained on a sort of a dripping tap process. It's not a one-off training event. It should be reviewed, and training should be given regularly. As Anna has said, in terms of color coding, the appropriate containers, and often this is where it falls down. And it's training, it's awareness raisings. We need posters in the appropriate language, informing both the staff, informing the patients of the correct segregation and categorization. And I come back to my Eastern Caribbean island, having purchased a very expensive autoclave, which then broke because people were putting coconuts in it. That talks to the fact that there wasn't waste segregation, and there wasn't waste segregation because there wasn't appropriate education, training, and follow-up. So absolutely essential.
May I also just say one thing as well? 2 very important things that we're finding, and this is with solid waste as well as biomedical waste. But when you have a segregation system, you should have try to put the different bin systems, the color-coded system, as a cluster. So then it gives the person who's depositing the waste the correct choice. If you've only left one bin and it's a red one, and then they have to go down the corridor for the grey one, often a person could not be bothered to do that, and then they would just deposit in that single bin. So having segregation systems and clusters is really important, but also having some way to ensure that if you've got bags inside those bins, if they're all black and then you take them all out and they all go into one lorry without that segregation system being repeated in some manner in the lorry, then they can all potentially get mixed up. So you might be thinking that you're segregating, but at the end of it, everything becomes mixed up. So as much as possible, it's also very useful to have the color coding repeated in the color of the bag system as well.
Yeah, this topic has got us chomping at the bit and lots of comments here, but also I would add, in the world of biomedical waste, if you've got waste segregation, then you're doing okay. So say, for example, you have 1 bag of hazardous waste to 9 bags of non-hazardous, then they go their particular routes. But if that 1 bag of hazardous waste is mixed with the 9 bags of non-hazardous, you've then got 10 bags of hazardous waste. So the segregation is actually minimizing the volume of waste and the hazards associated as well. And I would also say accountability. If we're in a healthcare treatment center or wherever, if the system isn't working, someone has to be accountable. And that accountability needs to be the high-level manager within the healthcare center or the hospital, designated to be responsible. And if it's not working, they have to put measures in place to fix it. Someone has to be held accountable.
Yes, indeed, very, very good points. I believe it has become nearly the time, but I just want to add one more question and then we can finally close, because we have talked about the importance, and I think we've focused this series of trainings in trying to give some possibilities to least developed countries to provide them with a broad range of technologies, of waste treatment options. And so we have a couple of questions in regards to that. So they're asking how, or any advice on, yes, technology is great, but of course, developing countries sometimes cannot afford this technology. So what is the best alternative for developing countries? And if you know, or if you're aware, if there are any ways to get funding for these type of technologies for COVID-19 support, where can they reach out to get some of this external financing in order to get those modern technologies?
Well, I would say if we're looking at the low end of technologies, you know, if it eventually has to go to landfill, if there's some way of trenching and burial, that is a better solution than just dumping per se in an open dump site. I would also say the demontfort brick incinerators are low cost, and often if you get a community together or as a group or as a municipal, the amount of finances it requires, that is a solution that is often used. And because they have gone through this iterative process of design, they are far more effective than any, you know, the actual design, the system to the second chamber, etc. It burns very well in comparison to just a brick built incinerator with 1 chamber. So I would say there are cheaper alternatives, but the worst case would be burial in a committed trench and separation of people to enter that site. Over.
Anna, anything to add?
Well, I don't want to talk about Philippines again, but that's the example that for me was one of the most challenging one, because the reality of the country at the time was not the best due to the situation left after the typhoon, and adding on that, it was not allowed incineration in the country at the time. So that's another level of complexity when a country doesn't allow you to have incineration. So the solution at the time was actually to do the trenching, separate trenching in a dedicated cell, because it was better than nothing at the time being, and there was no, it was not possible to have any donors or as an immediate solution. So sometimes we need to get some interim solutions, and that, in my opinion, would be better than having nothing or just burning, having open burns and or dumping mixed with general waste.
Sure. And from my side, I would say that in terms of seeking support, whether it's from development donor type bodies, then depends who we're talking about. The big players like the regional development banks, World Bank, they tend to only work on a sort of governmental arrangement relationship. So that would be very much for the Ministry of Health to lead on that, and explore with the larger development donor agencies what can be done. Management of COVID waste is on the radar of all of these agencies. If we're talking about a healthcare facility, then that's more difficult because they don't typically, the large donor agencies typically don't come down to that level of operation, but there are some private outlets which could be explored. I would say that in the meantime, though, there are things that could be done without money, and that is, without money, a healthcare centre can introduce quite strict waste segregation, minimizing the amount of hazardous waste, doing routinely what they do with the normal waste. But again, as has been said, proper segregation and proper training don't cost money, can go to the municipal dump site where you can have a dedicated location, a dedicated trench. And again, if we're talking at the higher level, the ministerial level, and I come back to the enabling environment, the donors don't want to talk in very general terms. So if you have created data, that's going to help. If you can say we have so many areas of waste generation, we're generating on average this much waste, of which this much is hazardous. So again, it doesn't cost money to start to developing the data, which is going to facilitate your discussion potentially with the donor development agencies. So there's still quite a bit that can be done before you arrive at the point where you may have the necessary funding.
Very well. Thank you very much. Yes, indeed, there is so much we can do before, and there's so much we can do at the lower level and with the available resources that we have. So with this, I think it's time now to conclude today's webinar and this series of trainings. With this training series, we've really tried to increase awareness, provide guidance on how to deal with waste management in a pandemic situation, and provide some basic information, but also include lessons learned from our specialists and what we see in the ground. So when our colleagues here go and assist countries, we try to provide you all with those lessons learned. So I wanted to thank everyone for taking the time to attend to this training, all the attendees, but in particular as well to our speakers for participating or for your work and for your time. And as well, I wanted to thank everyone behind the scenes for making this series of trainings successful, such as Murli Tumarakudi, our communications team, Mr. Ravi Shankar, and Thomas and Aman that are working behind the scenes as well. So with this, I conclude, and I wanted to thank you, everyone. Stay safe and healthy. Apologies for the delay. We overran a little bit, but the discussions were very much interesting, so I thought it was a shame to cut off before time. So with this, I pass the floor, and I wish everyone a lovely day.
Thank you very much.
Cheerio, thank you, everyone.
Bye-bye.
Bye.
Hello there. Okay.